Hello everybody, my name is Taylor. This is Chit Chat Thursdays with Taylor. In today's episode I have a very special guest and I'm honored that he's here. And let's do this. I want to introduce Dr. Thomas Dobbs, and he is our State Health Officer here at the Department of State of Health of Mississippi. Let's do this and tell me about yourself.
Hey, so thank you so much for chatting with me. So I'm Thomas Dobbs. I'm an infectious diseases and internal medicine physician, and I've been doing public health work for a long time. And I've been doing infectious disease work for a long time, and so the COVID thing is kind of right up my alley. You know, stuff that we've been working with for years.
I have a lot of questions and I'm ready to hear your answers. Let's get straight into it. What does your job as a state health officer mean, and what do you do for the state of Mississippi?
You know, there's a lot of responsibilities for the Department of Health, and so I'm over the Department of Health, right? So we do all sorts of things. Not only do we do like the disease response, like the COVID, and we investigate disease outbreaks and provide guidance, do lab testing, all that sort of stuff, but also within the health department we do things that people maybe don't know about. You know, we're over the Women, Infant, and Children program for like feeding babies for moms, making sure they have formula and that sort of thing. We're over making sure that women have reproductive health options as far as like, you know, birth control or can do family planning. We treat sexually transmitted diseases, tuberculosis, those sorts of things. And also we try to promote health equity, making sure that everybody has access to healthy opportunities. Working on also racial equity is a big part of what we do. And also too, we make sure a lot of health facilities are safe. Hospitals, nursing homes, also restaurants, child care centers. So it's just a whole bunch of different things that I get to work with.
That sounds awesome, that what you do. We've been living in the COVID-19 pandemic for over a year. Why is it important that it needs to end as soon as possible?
Boy, there's so many reasons it needs to end as soon as possible. I mean, I think a lot of us want it to end just so that we can get back to normal, right? Mm-hmm. We want to go back to school. We want to do in-person classes. Yes. We want to, you know, go to social events, have weddings, not go to a funeral and be scared that you're going to catch COVID. I mean, those normal things are very important, but we also can't forget that America has lost over 600,000 people. It's astounding. It's about 2.5 times as many people as the United States lost during World War II. And just think about that. How many people have died who would still be with us today? In Mississippi, we've lost over 7,000 people. So going forward, every single death that we see from, you know, basically from a month or two ago to going forward was preventable. All the hospitalizations, the people having to be on a ventilator for a month, that doesn't have to happen. So if we want to get back to normal, but also not put people and families through suffering and sometimes death, we need to put it behind us. And the best way for us to put it behind us is for as many people as possible to get vaccinated so that they're protected from COVID.
That is right. What is the Delta variant, and what can you tell me about this? Because I've been hearing it all over the news and I don't really know what it is. Could you enlighten us?
Yeah, the Delta variant is a very important piece of conversation to have because we're starting to see a lot of it. We saw a very big increase in the Delta variant last week, and probably within a week or two, it's going to be the predominant strain, so it's going to be the dominant COVID that's circulating in Mississippi. And the reason that's important is several things. It's way more contagious. It's more than 2 times as contagious as the COVID that we're used to dealing with, right? It's even more contagious than the UK variant, the one that we have a lot of right now. But also it might be a little bit more deadly. And the vaccine is maybe not quite as good. It's pretty darn good. It's going to be close to 90%, but we're going to see some more people get sick. So we collectively need to prevent transmission if we can by just being a little bit careful, you know, see what's going on, and of course, you know, getting the vaccine is the best thing that we can do.
Yes, I recommend everybody get vaccinated.
Thank you so much.
Because I'm vaccinated, and I think everybody should. Your health is important.